We are joined by Chief Todd LeDuc. He is the Chief Strategy Officer for Lifescan Wellness Center. Thank you so much for joining us.
Thank you for having me.
Now, health issues with firefighters remain to be at the forefront. So can you tell me, you call it the three-legged stool. What are those leading occupational health threats?
Sure. When you really look at what firefighters are suffering from in terms of disease processes that are job-related, that really are killing firefighters or causing permanent disability, it's really the three biggest are occupational cancer, cardiovascular disease and cardiovascular events, and then behavioral health, the whole broad spectrum, with the far end unfortunately being firefighter suicide. So those are really the three. When you put them together, those are what we see firefighters continuing to be affected with, and we continue to lose firefighters from these preventable diseases that we can do something about.
What is the magnitude of these health issues in fire services?
It's enormous. It's huge. We are seeing on the behavioral health side, there's some studies out there saying 49%, one out of every two firefighters thinks of suicide at some point during their career. Upwards of 16% have been reported to attempt suicide at one point during their career. Post-traumatic stress disorder rates reported as high as 37%. Similar to returning vets from military combat. Cancer rates, generally our firefighters across the board are 14% higher than members of the general public. Certain types of cancers are actually astronomically higher for firefighters. And on cardiac issues, we're finding annually our line of duty deaths, over half of them are from cardiovascular events. Obviously risk factors may play a role in that, but we know that occupational exposure to the rigors of firefighters plus the chemicals that are in toxic fumes that we're exposed to all play a role in each of those three diseases.
So what can the leaders here do to help mitigate this risk?
There's really a couple things from the chief's perspective. Is we need to be sure that we're putting risk mitigation practices in place. What are the things that we can do equipment-wise, training-wise, personal protection mandates for our providers. There's also education and awareness that we need to be doing. We need to do a better job training our firefighters that these risks exist, and that they can take steps to mitigate or lessen that risk. And then the third part is what Lifescan Wellness Centers does so well. We see 40,000 firefighters across the country in 24 different states, but it's annual early detection. And that's a key thing for departments. We still have a number of departments that don't do annual screenings of their firefighters for medical early detection disease processes. And that each of those three, the risk mitigation, the education, and then the early detection, are really, the elements of giving every fighting chance to reduce those numbers and protect our firefighters.
And I understand that you're here at the pavilion and firefighters can come down and get a check.
We are. So Lifescan Wellness Centers has been a long time corporate supporter of IAFC. We actually have 3 clinical teams operating on the exhibit floor. So you can learn a little bit about the NFPA 1582 physicals that we offer and provide. We actually come on site to your department in 24 states. And then also we're offering complimentary screenings right here at the exhibit halls. So, and I'm proud to say we've had at this conference and other conferences, we've found some pretty significant abnormal clinical findings that we've been able to save people's lives that are attending conferences by early detection as well. So it's pretty powerful to say, not only learn about what we do, but also to provide a service that while you're attending a conference may save your life.
Fantastic. Thank you so much, Chief LeDuc. Thank you for joining us.
Thank you for having me again. Enjoy the conference.